Hey guys, it's Crystal from livingwithgastroparesis.com, and today I want to talk about something that I've been seeing pretty frequently in Facebook posts and in my blog comments, and it's something that I myself have struggled with and did struggle with for certainly like the first 5 years after I was diagnosed with gastroparesis, and that is the idea that an answer lies with drugs, doctors, more diagnoses, kind of the D's, right? That if we just find the right doctor, if we just keep looking, somebody will have the right drug or the right procedure or some kind of medical answer to basically rid us of gastroparesis. And certainly that would be beautiful, wouldn't it? That's part of the reason why I was in DC last month at the Digestive Health Alliance Advocacy Day to talk with our lawmakers about funding and supporting medical research when it comes to gastroparesis and treatments for it. But as of right now, unfortunately, there is just not a lot of good, effective medical treatment for gastroparesis. There are great docs out there, docs who really want to be able to help their patients, but the drugs that are available are limited, the procedures are limited, and really just kind of the understanding of gastroparesis, especially, idiopathic gastroparesis, is still pretty limited. So personally, myself, like I said, I spent probably the first 5 years after I was diagnosed kind of chasing that elusive expert or answer, whether it was, GI docs or going to the Mayo Clinic for literally weeks and weeks at a time to see every specialist pretty much and have every test that they could offer to me, or seeing alternative and complementary practitioners, spending thousands of dollars on treatments and tests and supplements that insurance wouldn't cover, thousands of dollars that I did not have, but I was desperate to find an answer. And I think many of you are probably in a similar boat. I see it. Like I said, I see it on Facebook. I see it on the blog comments. Certainly when I work with people in our group programs, you're really searching for that answer. And of course, because this is a life-altering condition, it's one that is really difficult to live with, especially when it's not well managed. So for me, what I eventually found was something that turned everything around. It gave me more consistency in my symptom management than a drug ever had. It gave me more knowledge about my own version of gastroparesis than any test or any doctor ever had. And it really gave me more of a sense of control than anything else I had tried, and that is what I now call the comprehensive management plan, which is specifically rooted in self-care. And so for myself and for the hundreds of people now probably that I've worked with individually and in group programs who have gastroparesis, this has really been the key. This has really been what makes everything else more effective. So I'm not saying that medical treatment isn't appropriate for gastroparesis. Certainly it is. I have the gastric neurostimulator implanted. But when I started really practicing those self-care aspects of the comprehensive management plan, everything worked better. So I think and I hope that that's kind of exciting, because it means that you have control over how you feel, or for a large part at least, on a daily basis. It means that the choices that you make every day have a big impact on how you feel today, how you're going to feel tomorrow, consistency over time, and your overall health and well-being. So you can find all about the comprehensive management plan in my videos and my books and my blog. Basically when it comes to the self-care part, which is most of the management plan, we're talking about lifestyle stuff. So that means good sleep hygiene, good sleep habits. That means physical activity, appropriate physical activity for the condition that you're in and your situation. That means certainly a supportive group of people around you, whether that's medical professionals or your friends and family. That means supplementation when appropriate. It means a nutrient-rich, GP-friendly diet. It certainly is good coping skills. It means really understanding the effect of the stress response on the body as a whole and digestion in particular, and a really consistent practice of the relaxation response. So these are all things that are part of the comprehensive management plan that are, self-care things. These are things we can do for ourselves, and they don't have to cost a lot of money. So I would encourage you to think about this a little more. If you're kind of hanging your last hope on the next doctor's appointment or the next drug that you try, maybe spend a little bit of time thinking about these self-care things and thinking about if you really have a really good management plan based on these self-care things, if that's really the foundation, because like I said, that's going to make everything else more effective. So ask yourself this, just for this week, what's one thing that you can do every day to improve your well-being? Okay, self-care is really about supporting the body to function the best that it can in any given moment. And of course we want to do that, even if we're medicating, even if we're managing our symptoms with a procedure or something else, we still want to support the body to work as efficiently and as effectively as possible at any given time. So think about this week, what's one thing that you can do? Maybe it means really focusing on getting a good night's sleep. And sometimes that's difficult, but we have to set ourselves up for the best shot possible, right? So maybe that means that you don't turn on your computer for an hour before you go to bed. And especially, not on the message boards talking about GP and getting yourself all anxious before you go to bed. Maybe it means just asking your spouse or your best friend or your child to go for a walk with you every night after dinner to help move things through the stomach and alleviate your symptoms. Maybe it means 5 minutes in the morning or 5 minutes in the evening to sit quietly and just breathe. Just focus on your breath, because what that will do is calm your body. It kind of balances out the nervous system so that if you're in fight or flight mode, and everybody on average has 50 instances of being in that stress response, in that fight or flight mode every single day. And that's a person without gastroparesis. So if you are worried every time you sit down about what you're eating, if you're worried all day long about what you're going to eat next, think about all of the additional stress responses that you have on top of that average. That's a lot of time for your body to be flipping into fight or flight mode and shutting down digestion. Obviously, that's not supportive to a gastroparesis management plan. So taking those 5 minutes in the morning or in the evening or at lunchtime to just sit quietly, focus on your breath, that switches off that fight or flight response, and that allows your body to start to function the way it is supposed to turn digestion back on to the best of its ability. So just pick one thing and commit to yourself that you're going to do that one thing every day for this week. Now, as you may have heard, I am running the Living Well with Gastroparesis program starting in August. We go over everything I talked about and a lot more to really help you build a strong foundation of self-care so that over the course of 3 months or 4 months with the warm-up classes, you really start to see a shift and you really start to see a difference, and you kind of take back that control and you realize that the choices that you're making really are impacting how you feel. And I have already given away 2 free spots, but I'm giving away 1 more free spot this week. And all you have to do is comment on this blog post and tell me that one thing that you're committing to do, that one self-care act that you are committing to do for yourself this week. And then I will randomly select a winner from the blog comment. But either way, I really do hope that this gives you a little bit of hope. That if you are in that place where you're thinking that your last hope lies with the next doctor that you see, or getting into a certain clinic, or trying a certain drug, that this gives you a different perspective. Not that those things aren't important, not that those things may not help, but there's something that you can do right now for yourself to help everything work better, to help you feel better. The people that I've seen, really turn things around, myself included, that this is what's really made a difference. So with that, I will see you either in the group program or on Facebook, or most certainly in future newsletters. Quick note about that: if you use Gmail, they are rolling out some changes to our inboxes, and they will be automatically sorting the mail as it comes in. So if this hasn't happened yet, be on the lookout. I think they're doing it in stages, but they'll be tagging your messages with different labels when it comes in, and some stuff will skip your inbox altogether. So they are tagging messages from me as promotions, which means you won't see them in your main inbox. If you want to see them in your main inbox, you can just drag my message from the promotions box into your primary inbox tab, and then you'll make sure that you get all of the messages. I would recommend doing that because I have some really good stuff coming out to you by email in the next couple of months. Q&As with some other experts on GP and GP management, stuff I think you're going to be really interested in. So take good care, and I'll see you next time.